Nick Foles, beloved Eagles quarterback. What do I have in common with him? Well, postural orthostatic tachycardia syndrome. Both of our lives have been affected by POTS. Nick Foles himself doesn't have POTS, but his wife, Tori Foles, does. So just let's get a show of hands here. Who in this room knows what postural orthostatic tachycardia syndrome is? Or I know I've told Isabella about it a bit, but see, nobody really. So, what is POTS? POTS is a form of dysautonomia, which is a disorder of the autonomic nervous system. This is a diagram of the autonomic nervous system. There's two branches, the sympathetic and the parasympathetic nervous system. And basically, the autonomic nervous system is responsible for all of the subconscious or automatic functions of the body. So it's responsible for heart rate, blood pressure, digestion, dilation and constriction of the pupil, kidney function, temperature control, and a lot more. And so diagnostic criteria for POTS is an increase of heart rate by 30 beats per minute, at least 30 beats per minute, or 40 beats per minute, or a heart rate above 120 beats per minute within 10 minutes of standing. So 80% of patients are female, often between the ages of 15 and 50 when they're diagnosed, or included with this, I didn't specifically put this, but also people who are assigned female at birth but aren't necessarily female identifying. And the severity of symptoms really do vary from person to person, but 25% of patients will be disabled and unable to work. Functional impairment in POTS has been compared to that seen in COPD, or congestive heart failure, and quality of life has been compared to patients on dialysis for kidney failure. It's estimated that if POTS was to be diagnosed at the correct rate, it would be, it is estimated that it affects 1 in every 100 teenagers, but many doctors are completely unfamiliar with POTS, and a lot of patients go a long time seeing different doctors, being told different things that were incorrect. A lot of doctors haven't even heard of dysautonomia, don't learn about it in medical school, and if they do, it's maybe like one part of a lecture. And so the average diagnostic delay between the onset of POTS symptoms and a diagnosis of POTS is 6 years. I went about 9 years between when I had my first dizzy spell and when I received my official POTS diagnosis from a cardiologist. So these are just some of the symptoms of POTS. And everyone will have different symptoms. It's much more than just tachycardia, which is the high heart rate, which is obviously everyone who has POTS does have to have some degree of postural tachycardia because that is the diagnostic criteria. But for most patients with POTS, symptoms are often worsened or happen when they stand up or sit up or change positions. So some common symptoms include blood pressure changes. So some people's blood pressure drops and some people's blood pressure jumps when they stand, fatigue, headaches, lightheadedness, palpitations, exercise intolerance, GI problems including, so one thing that often goes along with POTS or other forms of dysautonomia is a condition called gastroparesis, which I actually have, which is a partial or in a more severe case complete paralysis of the stomach, because that is controlled by the vagus nerve, which, surprise, surprise, is part of the autonomic nervous system. So other symptoms, brain fog, which means kind of when you're confused, you're kind of not able to think clearly. It kind of just feels like there's just a haze on your brain. Shaking, syncope, which is the official name for fainting, which is not required. That's a common misconception about POTS, is that everyone with POTS faints. Much more common is pre-syncope, which is that feeling right you're going to faint, which may or may not be followed by full syncope. Chest pain, shortness of breath, coldness or pain in the extremities. A lot of people with POTS also have Schrodin's. I know I didn't quite pronounce that right. exercise intolerance, temperature intolerance, you may have noticed that I'm extremely heat intolerant, but other people with POTS may have cold intolerance as well, or they might have both, or one, or the other, or neither. And the list goes on and on. Another common comorbidity or diagnosis that often also exists with POTS is mast cell activation syndrome, which I'm actually currently being tested for right now, which basically the mast cells in your body are responsible for allergic reactions. So when you have a mast cell activation problem, your mast cells are overreactive, so you basically, the catchphrase for mast cell activation syndrome is being quote-unquote allergic to life. And another diagnosis that is often seen with POTS, or POTS is often seen in it, is Ehlers-Danlos syndrome or hypermobility spectrum disorders. And the EDSs say there's different subtypes, but a good percentage of people with the hypermobile form of Ehlers-Danlos syndrome and hypermobility spectrum disorders, I have a hypermobility spectrum disorder, will also have POTS. Actually, the combination of POTS, mast cell activation syndrome, and Ehlers-Danlos syndrome is often referred to as the trifecta because those three conditions are often seen in the same patients, and it's not entirely clear why that's the case. So, with all those symptoms and its prevalence, you'd expect there'd be, a pretty straightforward treatment plan for POTS. You would be wrong. Currently, there are no FDA-approved medications for the treatment of POTS, and any medications prescribed are prescribed via off-label use. But some common ones that you might see prescribed for POTS are Florinef, which is, it increases blood volume and helps with fluid retention, because people with POTS have a hard time with hydration. Or it's not that we're not drinking enough, it's that we need to be especially hydrated because the problem with POTS is our brain, our nervous system doesn't send quite the right signals to our heart and our blood vessels. So when most people stand up, your blood vessels constrict in your legs to help with blood flow, but with POTS patients, our brains and our hearts aren't quite in sync, so we have to do different things to try to help with that. So I'm actually on Florinef myself. Another medication that's often prescribed is Midodrine. I'm also on Midodrine. Or other types of blood pressure medications, either to raise blood pressure or lower blood pressure. There are beta blockers, which are actually not advised for use in patients with mast cell activation syndrome, as they can make that condition worse. But beta blockers serve to lower the heart rate to treat the tachycardia portion of POTS. There are also, I don't remember exactly off the top of my head what they're called, but there are other similar medications to beta blockers that don't affect mast cell patients in the same way. Stimulant medications, such as Concerta, which are often prescribed for ADHD, are sometimes prescribed for POTS patients, especially if they are experiencing a lot of difficulty with fatigue or brain fog. Another treatment that happens is IV saline fluids. So this isn't a first line of treatment, and for most POTS patients is not the regular treatment. It's used a lot of times in severe flare-ups, which is when our symptoms are a lot worse. So I often, if I'm having a day where I've collapsed, passed out a lot of times, or if I'm just unable to function, I'll go to urgent care or the ER to get 2 liters of fluid. But some POTS patients, especially when they have more severe gastroparesis and are unable to get all their fluids by mouth, will have regular IV fluids and oftentimes may end up with a central line for more continuous access, but that can cause a lot of complications such as infection, sepsis, and also it's a very time-consuming procedure, or not procedure, but treatment. There are also a variety of other medications. I actually just started on a new medication, but I don't know enough about it to really talk about it yet. But there's also a variety of non-medication treatments or lifestyle changes that are recommended to POTS patients typically before medication is prescribed. The number one thing with POTS is we're actually supposed to have more salt in our diet. I thought the meme might be appreciated. So it's kind of funny because a lot of times it's like, for good heart health, reduce your sodium intake, but for POTS it's actually the opposite. We're supposed to, I literally have to put salt on just about anything, and other forms of electrolytes. So salt is a type of electrolyte, but there's other types of electrolytes. So a lot of times you'll see POTSies, that's what we call ourselves sometimes. Drinking a lot of Gatorade, you may have noticed, I always have Gatorade on me. There's other types of electrolytes. I personally haven't found one that I like as much as Gatorade. I know there's a lot of sugar in it, but because a lot of times just water alone, we sometimes have a hard time with retaining that fluid we drink. So we can drink and drink and drink and drink, and if we're not also adding salt and other type of electrolyte, it might not stick as well. So exercise is one, but that doesn't mean that any exercise works for us. So there's certain types of exercise that, really we shouldn't do. Like, I can't run. I'm not really supposed to run. I like to run, but it's just not good for me. I know some people with POTS will, if that's a really important goal to them, work up to that or try to do certain types of exercise. But for the most part, the most recommended types of exercises for POTS patients are either swimming, because gravity doesn't play as much of a role in swimming, as well as recumbent aerobic exercises, so like recumbent biking. So there's this thing called the Levine protocol, which is just a very regimented way of reconditioning, because the idea with exercise is to prevent deconditioning, which can worsen our symptoms. Also recumbent rowing, and I know one of my doctors recently suggested that I try Pilates, which is also helpful, because in addition to POTS, I also have a hypermobility spectrum disorder, so that limits what types of things I can do even more. So, you might suggest yoga. Everyone loves to suggest yoga. But for a lot of POTS patients, especially hypermobile POTS patients, most types of yoga is actually contraindicated. My joints are already stretchy enough, because Ehlers-Danlos syndrome and hypermobility spectrum disorders basically, this is likely why it causes POTS, is a defect in our connective tissue. So that causes hypermobility, skin elasticity, skin fragility, and a whole slew of other issues, including POTS. Another treatment is diet. So this doesn't mean to go on a diet, but to, instead of eating bigger meals, like 3 big meals, eating frequent smaller meals, because that can cause blood pooling in our stomach, so that takes some of the blood away from other parts of our body when we need to digest a big meal. Also, because with gastroparesis, it's harder to digest more at once. Other treatments, I managed to not put them on there, include compression garments. See these beautiful compression socks. So one thing that happens a lot with POTS patients is our blood pools in our legs a lot, and compression garments, well, it also pools elsewhere, but it's the most problematic when it pools in our legs, because that blood needs to go back up, but our blood vessels aren't always able to do that on their own, so compression garments help give our blood vessels a little extra support, as well as lovely counter maneuvers such as this one here. So I actually was at my cardiologist on Tuesday, and he's like, "Are you putting your legs up against the wall a lot?" I'm like, "I'm doing my best." Because this allows the blood to get back to our head. Other things that some POTS patients do will have, instead of sleeping flat, sleeping on somewhat of an incline, so that the blood can flow a little bit better. Other things can be crossing legs, squeezing the muscles in our leg, and like our calf muscles. Also, we're supposed to get up slowly and change positions slowly. I'm not always the greatest at doing that, but you can get an idea of just some of the various ways that we treat our symptoms. So POTS patients are often misunderstood, both by doctors and by our peers or people we interact with. So in my research for this paper and this presentation, I actually reached out to some of my personal friends, as well as to some of the online groups I'm in, especially on Facebook with a lot of other POTS patients, and asked them what they wanted. Well, I asked them about diagnostic delays. Part of my paper was I actually was talking about the variety of different struggles patients have had with being diagnosed with POTS, but I also asked what they wished doctors and just their peers would understand about our condition. So these are all, a lot of these are common themes, as well as I do have POTS, so I was able to kind of put my own, some of my own feelings about it too. But a lot of these, the number one thing POTS patients are told is that it's all in our head. And maybe not in those words exactly. 83% of POTS patients will be misdiagnosed with anxiety at one point or another. Or like in my case, I had an anxiety diagnosis, which was a valid diagnosis. I do have anxiety, but because I had that diagnosis, it made my diagnostic process for my POTS and other physical conditions take a lot longer. I started having dizzy spells in 6th grade. When I started going to the doctor about it, they tested for some of the, like anemia, some of this more simple, like straightforward stuff to test for. Although POTS is actually not that difficult to diagnose if your doctor is familiar with the diagnostic criteria, either through a tilt table test, which is basically you're strapped to a machine and they test your vitals at different angles, or through what's called a four-man's tilt table, so which is where they take your orthostatic vitals, so take your blood pressure and heart rate lying down, sitting up, and then standing for 3 minutes, standing for 5 minutes, standing for 10 minutes to see how it changes. Because everyone's heart rate usually will jump a little bit when they first stand up, but then it'll regularize itself. When you have POTS, that doesn't, the regularization doesn't happen. So in my case, my heart rate actually manages to bring itself down just like maybe 5 beats per minute at first, and then it'll have a huge jump. So I'll be sitting, my average resting heart rate is about 70, and then I stand up, and it's usually at least 100. I actually know, so one of the people I talked to, or one of the comments I got from a POTS patient was about an experience that they had she was hospitalized, and she was on the neurology unit, and the doctors came in and were trying to tell her it was all anxiety. So what she did was she stood up, and her heart rate jumped from being in the 70s. She said it jumped at least 100 beats per minute, and it was in the 80s. She looked at her doctors and said, "Is this normal?" And they were trying to tell her it was all anxiety. She sat back down, and it went back down to 70, and said, "This is not normal." And the doctors tried to tell her that, one, they said, well, you have a standing phobia, or you have really great control over your heart rate, and you're making it jump 100 beats, you're making it go up for attention, which is ridiculous. We all agree that that is some major control over our bodies. Like, I don't know anyone who can willingly force their heart rate to jump 100 beats per minute. And that went on her charts, which are going to follow her forever. That's a common theme is being told that our symptoms are psychological in nature. Doctors refuse to listen to us sometimes, and that kind of leads, I'm going to skip down to, we know our bodies best. So if we say this is what we're experiencing, this is what we're experiencing. We have had to become experts in our own health in order to advocate for ourselves. And so sometimes people give us advice that's, people don't understand what's going on, and try to make decisions for us or suggest things to us, and we're like, thanks, but this is my body, I know what my body's doing. My body is sick, and this is why it's sick, and we know. And also, POTS is different for everyone. So like I mentioned, so something that some people get is, oh, so-and-so in my life had POTS, and this worked for them, or, oh, but she's not doing X, Y, Z, or, oh, if she can do it, you can do it. But POTS is such a variable syndrome. It's a syndrome. It causes all different levels of impairments and problems. So POTS is a chronic condition, hence this meme. There's no cure. So we're still sick. Yes. We may have good days and we may have bad days, but we still have POTS at the end of the day, and we are often really are trying our best. And it's frustrating when we often will lose friends because people are unable to cope with our chronic illness, or will just leave us behind in the dust, or refuse to believe us. So I know a lot of people who have lost friends after being diagnosed, and we're not faking our illness. So that goes along with some of the other ones. POTS is a real disorder. One person commented and was saying about how one of her neighbors was like, "Are you sick?" I mean, like real sick, like the flu. But POTS is a real illness. We have real symptoms, and we need real treatment. And another thing is, even some simple tasks or things that might be simple to other people aren't so simple for us. So showering is a big thing a lot of people with POTS struggle with. There's a lot of memes about that. Standing for long periods of time is not as easy for us as it might seem, especially if we're having a really bad day. Some people are completely bedbound by their POTS. The fatigue gets in the way of getting things done. So we're having to spend a lot of our lives taking care of ourselves, and that's okay, but we just might not function the way you expect us to. And just a couple more, plus, a couple more memes. Also, this one helps describe kind of what POTS feels like. Just because we look well doesn't mean we feel well. POTS is considered an invisible illness, and sometimes if you look, an invisible illness might become a little bit more visible. So you might see me a lot of the time walking with a cane, or wearing my compression garments, or on the floor. I think you've all seen me on the floor. I think that happened in class once, at least. But even if we don't look sick, doesn't mean we aren't sick. And also, we really, don't really want unsolicited medical advice. The chances are we've tried whatever it is you're suggesting. Juice cleanses. Celery juice does not cure anything. Yoga. Yeah, for some people, it can be great, but it's not going to cure us. Oh, you need to drink more water. You're just dehydrated. But in reality, POTS patients probably drink more water than just about anybody else you know. My mom was saying this to my cardiologist the other day, Ellie drinks more water than anybody else I know. My mom actually said that. Oh, the recommended fluid intake for POTS patients is 2 to 3 liters a day. So we are hydrated. We are trying this. We've tried that. We've likely done whatever it is you're about to suggest to us. It's one thing when we ask for advice, but if we aren't asking for medical advice, or if you're not our doctor, support is great. And again, it's more than just a fast heart rate. It causes all sorts of other secondary symptoms, which I went over. And at the end of the day, we're still the same person we were before POTS, and we're still people even though we have POTS. So just because we do things a little bit differently doesn't mean we don't still do them. And, I know this presentation was a little bit long. I'm passionate about the subject. But if you want to learn more, some great resources. So Dysautonomia International is a great organization. Actually, I'm going to their conference in July. It's going to be in Philly this year. Dysautonomia Support Network, Standing Up to POTS, the Dysautonomia Information Network are all great. And the Dysautonomia Project is great. They also have a great book called the Dysautonomia Project, and they are working to turn, one of their campaigns is to turn 6 into 15, so turning the 6-year diagnostic delay into a 15-minute. I think that's the Dysautonomia Project. Patsy Spoons, that comic on the previous slide, she has a lot of great informational, and also funny comics about POTS. And the Mighty, if you want more of a patient perspective, they also have information on a variety of other conditions. So thank you guys so much for bearing with my long presentation, and I hope you learned a little bit about POTS.